Hey everyone, and welcome to another deep dive. Today we're going to help you prep for that big clinical specialist interview.
Oh, yeah. Big day.
Huge, right?
Yeah.
And to do that, we're going to be taking a close look at Indeed.com's guide on clinical specialist interview questions and sample answers.
I love these guides. They're like peeking behind the curtain,
Yeah.
seeing what hiring managers are really looking for.
Exactly. No more generic answers or like crossing our fingers, hoping for the best. We're going to unpack their secrets and give you the tools to really stand out. So to start off, I think it's important to understand the mindset of the interviewer. Like, what are they really trying to figure out about you?
Well, in this case, it seems like they're focused on three main areas. First, your clinical expertise,
Yeah,
obviously.
got to make sure you know your stuff.
Then there's your approach to patient care. So
Oh,
how you interact with patients, your empathy, your communication skills.
makes sense. And the third area.
Teamwork. Because healthcare is a collaborative field, right? They want to see that you can work effectively with a team, communicate well, all that good stuff.
Yeah, that's key. It's like a puzzle, and you're showing them you have all the right pieces to fit into their team. Okay, let's dive into some of those tricky questions. One that always seems to come up is, what is your greatest accomplishment? I feel like so many people just freeze up with this one.
Yeah, it can be tough, but this Indeed guide actually has a really insightful sample answer that I think can help.
Okay, lay it on us.
The key here is to highlight quantifiable results. Don't just say you improved patient care, show them how you did it. Did you implement a new system that reduced wait times by a certain percentage? Or maybe you spearheaded a project that increased patient satisfaction scores.
Oh, so it's about proving your impact, not just what you did, but how well you did it. Love that.
Exactly. Numbers speak volumes. You want to demonstrate that you're not just competent, but that you make a real tangible difference.
I'm already feeling more confident just hearing that. Okay, so we've tackled expertise. Now let's talk about handling complex situations. You're in the hot seat and they throw you a curveball, some complicated clinical scenario. What do you do?
Well, first of all, don't panic. It's not about knowing all the answers off the top of your head.
That's a relief.
It's about showing them your thought process and how you approach problem solving. The guide actually breaks it down into a pretty straightforward approach.
All right, let's hear it.
Right, so first, gather all the necessary information. Don't jump to conclusions. Really take the time to assess the situation. Then analyze that information. Consider the protocols, best practices, any relevant research, and then make an informed judgment based on your analysis.
Makes sense. So it's like a mini detective investigation, but for problem solving.
Exactly. And finally, if the situation calls for it, consult with colleagues, supervisors, other resources to make sure you're making the best possible decision.
Ah, so you're showing them you're thorough, you're resourceful, and you're not afraid to ask for help when you need it.
Right. That shows a lot of maturity and professionalism, which interviewers really value.
This is gold, especially in healthcare, where things can change so rapidly. You need to be able to think on your feet and adapt. Okay, so we've got expertise problem solving. What's next?
How about staying ahead of the curve? Healthcare is always evolving new research, new technologies coming out all the time. So how do you show the interviewer that you're committed to continuous learning?
Yeah, that's a big one. How do you prove you're not going to get left behind?
The Indeed guide suggests a proactive approach to professional development. It's not enough to just passively absorb information. You got to actively seek out opportunities to learn and grow.
So what does that look like in practice?
Attending workshops and conferences in your specialty is a great start.
Right, keeping up with the latest and greatest.
And subscribing to leading medical journals, of course. Staying up to date on the research.
Okay, and is there anything else I can do to really drive this point home?
Absolutely. Mention specific publications or learning platforms that are highly regarded in your field. If you're a cardiologist, for example, you might mention the Journal of the American College of Cardiology or specific online courses from the American Mattern Association.
Ooh, yeah, that level of detail shows you're not just saying you learn, you're showing them exactly how you learn and that you're plugged into the right networks.
Exactly. It demonstrates a genuine commitment to staying at the forefront of your field.
Okay, I love it. So far, we've covered expertise, problem solving, continuous learning, all super important stuff. Now let's talk about something that can be a little uncomfortable, owning your mistakes. Nobody's perfect, right?
Right? Yeah.
So how do you address those inevitable slip-ups in a way that actually makes you a stronger candidate?
It's all about demonstrating accountability and a growth mindset. The sample answer in Indeed's guide highlights three key elements here. First, immediately admitting the mistake, then informing your superiors, and finally taking corrective action to prevent it from happening again.
Wow, that's powerful. It's not about hiding your mistakes. It's about tuning them into learning opportunities.
Exactly. Interviewers understand that everyone makes mistakes. What they want to see is that you can acknowledge them, learn from them, and use them to grow as a professional.
It's like showing them that you're not afraid to take responsibility and that you're always striving to improve. Okay, we're on a roll here. We've tackled some tough questions, and I'm feeling much more prepared already. But there's one more crucial aspect of healthcare. We need to discuss emotional intelligence. How do you navigate those emotionally charged situations that are bound to come up when you're working with patients who are often stressed, scared, in pain?
You're absolutely right. Emotional intelligence is crucial in healthcare. The Indeed Guide really emphasizes the importance of remaining professional, patient, and understanding in those situations. It's about recognizing and responding to the emotional needs of your patients while still maintaining your own composure.
I can imagine that's easier said than done, especially when tensions are high. What are some practical tips for staying calm and effectively addressing those challenging emotional dynamics?
One of the most powerful things you can do is validate the patient's feelings, even if you don't necessarily agree with them. Let them know that you hear them, you understand their perspective, and you're there to help.
It's about showing empathy without getting swept up in the emotional storm.
Precisely. And use active listening skills, maintain appropriate eye contact, and speak in a calm, reassuring tone of voice.
So it's not about suppressing emotions. It's about channeling them in a way that builds trust and rapport.
Exactly. Empathy and composure are essential for building strong patient relationships, even in the most difficult situations. It shows the interviewer that you have the emotional maturity and resilience to handle the demands of the role.
This has been incredible. We've covered so much ground already, and I feel like we've barely scratched the surface of this. Indeed.com guide. There's still so many questions and insights to unpack. Are you ready for a rapid-fire round?
Absolutely. Bring on those questions. I'm ready to share some concise, impactful tips that'll help you navigate those tricky interview scenarios.
Okay, let's kick things off with a question that's become pretty standard in healthcare these days. Experience with electronic health records.
Oh, yeah, those EHRs.
They're everywhere now.
Yeah.
So how do you convince the interviewer that you're tech-savvy and ready to go?
Well, the key here is to be specific. Don't just say, I'm proficient with EHRs. Name the actual systems you've worked with, like Epic, Cerner, MedTech, whatever it is.
Right. Show them, your stuff.
And highlight your level of expertise.
Yeah.
Have you trained others on the system? Been involved in implementing or customizing it?
So it's about showing depth, not just that you've used it, but that you really understand it.
Exactly. Those details make a big difference. Okay, ready for the next one?
Hit me with it.
Handling difficult patients.
Ooh, yeah, we've all been there.
It's a classic interview question. So how do you show them you can handle those demanding or argumentative patients while still providing great care?
Well, I guess staying calm is key, right?
Definitely. But you also want to demonstrate your de-escalation skills and your commitment to patient-centered care.
So how do I do that?
Share a specific example. A time when you successfully navigated a tricky patient interaction.
Okay, so walk them through it, step by step.
Right. Focus on your communication techniques. Did you use active listening, empathy, clear, concise language?
And how about staying professional even when the patient's not?
Absolutely. You got to show them that you can remain calm and respectful, even under pressure, and that you can find a solution that works for everyone involved.
It's like proving you can handle a code blue, not just medically, but emotionally as well. All right, what's next in our rapid fire round?
How about managing high-stress situations?
Oh yeah, healthcare can be intense. Long hours, tough decisions. There's a lot to handle.
It is. So the interviewer wants to know that you can cope with that stress without burning out.
So how do I convince them of that?
Talk about your strategies for managing stress and maintaining your well-being.
Okay, so like taking breaks when I need them.
That's a good one. Or maybe you have a regular exercise routine. Or practice mindfulness.
I do yoga. Would that count?
Totally. It's about showing them that you're proactive about your mental and physical health and that you have healthy coping mechanisms in place.
It's like having a toolkit for stress management.
Huh.
All right, I'm liking these tips. What else do we have?
Okay, this one's a bit sensitive but important. Delivering bad news.
Yeah, that's never easy.
It's not.
No.
But it's a reality of healthcare. So how do you approach those conversations with empathy and honesty?
Well, I imagine it's about being direct but also compassionate.
Exactly. You want to demonstrate both your sensitivity and your commitment to clear communication.
So how do I convey that in an interview setting?
Share a specific example of how you've delivered bad news in the past.
Like a time when I had to tell a patient something difficult.
Yeah. Focus on how you handled it. Did you choose a private setting? Use clear and straightforward language. Allow the patient and their family time to process the information.
And what about offering support and resources?
Absolutely, that's key. By highlighting your thoughtful approach, you're showing the interviewer that you can handle these sensitive situations with grace and professionalism.
It's like demonstrating that you can be both a skilled clinician and a compassionate human being.
Mm,
Okay, last one for our rapid fire round, I think.
ready. It's about ensuring quality care while meeting productivity targets.
Oh, that's the eternal struggle, right?
Yeah.
Balancing efficiency with excellent patient care.
It is. So you want to show them that you can do both.
Okay, but how?
Highlight examples where you've streamlined processes, implemented time-saving strategies, or delegated tasks effectively.
Like finding ways to work smarter, not harder.
Exactly. Maybe you introduced a new workflow that eliminated unnecessary steps, or developed a system for prioritizing patient needs based on urgency.
So it's about being both efficient and effective.
That's it. You want to demonstrate that you're committed to providing the best possible care while also being mindful of time and resources.
You know, it's really amazing what we've been able to pull out of just this one article from Indeed.com.
It is pretty impressive.
Like we've uncovered all these hidden expectations that most people don't even realize are there.
Right. It's like a secret roadmap to interview success.
And for a listener, having this insider knowledge is huge. It's like having a cheat sheet for the interview game.
I especially love how the Indeed guide goes beyond those vague, surface-level tips.
Totally. They give you actual examples and practical strategies to use.
Yeah, it's almost like having a mock interview with a seasoned hiring manager.
And you know what's even better? Even if you're not interviewing for a clinical specialist role, the principles we've talked about today apply to pretty much any interview.
Oh, absolutely. The ability to showcase results, problem solve, highlight your learning, and show off that emotional intelligence. Those are valuable skills across the board.
It's like having a master key that unlocks success in any field.
Couldn't agree more.
Well, I don't know about you, but I'm feeling way more prepared for my next interview after this deep dive.
Me too.
Yeah.
It's amazing how breaking down these questions and understanding the interviewer's perspective can make such a difference.
Right. It's all about being prepared, thoughtful, and authentic.
And don't forget to let your passion shine through.
Yes. That's what really makes an impression. When you genuinely care about the work, it shows.
Couldn't have said it better myself.
So to wrap things up, I want to encourage everyone listening to check out the full article on Indeed.com.
It's a goldmine of helpful tips and sample answers.
And remember, you've got this. We're all rooting for you. Thanks for joining us on this deep dive, and good luck with that interview.